Hi, I'm here to do an assessment of cardiovascular assessment, respiratory assessment of the patient. First, I'm going to start with assessing for the patient sitting position, and I'm feeling the patient has a relaxed appearance. He's not struggling to breathe. You see no forcible breathing, no retractions, no audible edema, no circummolar cyanosis, and no pallor. The patient has temperature is warm, right? And you see equal head distribution in upper extremities and the arm as well. Since I'm already here, I'm going to feel the patient for temperature close, proximal, and distal. And the temperature is warm, and the capillary refill time less than 3 seconds. No nail clubbing. And I'm gonna move on to um actually because the darker color has darker brown color here. I'm going to ask the patient to open the mouth because it's best to assess inside of the brain and no, can you close your mouth? And no signs of cyanosis. Moving on, I'm going to I'm going to ask the patient to lay in a 35-degree angles because I'm going to inspect the carotid artery. I mean, the jugular vein distension. And move your neck to the left. So I don't see no bulging of the jugular vein. When you see bulging of the jugular vein, it could indicate hypovolemia or heart failure. Normal. And as I'm here, I'm gonna look for carotid pulsations. You have to look very close to see this, and I see the carotid pulsations. Now I'm gonna feel with the pad of my finger, not on top here, but I'm gonna go lower, and the is present, is regular, um, is a rapid brisk upstroke, and is smooth. Okay, so with this, I'm gonna also feel for the trills. The trills will be a care purring. It could indicate some some um, underlying pathological conditions here, and it is no trills. And also for breweries, you assess with the bell, the stethoscope. No breweries. And I'm gonna ask the patient to sit down because I'm gonna move on here and I'm gonna palpate, I'm gonna inspect the chest. The chest muscles is symmetrical. I see no visible scars which can indicate some prior surgeries. And I see also it's normal here. So what I'm gonna do is with the pad of my fingers, I'm gonna second intercostal space, microventricular line, second intercostal space, right sternal border. You're gonna feel for trills. You're gonna feel for lifts. Second intercostal space, left sternal border. Then you come fourth intercostal space, lower sternal border. And then you go mid clavicular line, fifth intercostal space. What you're doing here, you assessing for lifts. You're feeling the move, your finger lifts. And the hips is gonna be the rolling sensation that you could feel in the patient. I didn't hear none of the stuff. So now I'm gonna move on for the osculation. The osculation, I'm gonna osculate on the second sternal border, second intercostal space, right sternal border for the aortic, pulmonic, tricuspid, mitral valve in the point of which is next to the point of which is the point of max index. You have to note S1, S2, lub dub, and you use a diaphragm with the stethoscope first. S2 is louder at the apex of the heart. Then you move here. Can you breathe? The pulse is 72. With this, you should have already previously done the blood pressure bilaterally is 120/68 bilaterally, and the epical pulse is 78. I heard no S3s, S4s, which can indicate another like can indicate heart failure, and also ask the patient to lean forward. You do the same thing. When the patient lean forward, you bring the heart next near the chest wall. It makes facilitate to hear murmurs with the S3, S4s. Now you're going to ask the patient to lay in a lateral position because that also facilitates, to oscillate for the normal sounds. Standing. Okay. No S3S sounds. And now I'm going to move on. You can please sit down. I'm going to move on to the inspection of the respiratory inspection. So with that, with the respiratory, you also assess the patient for head distribution, which is equal, temperature, which was already done, the color, which is done too. The color is normal, color brown, light brown color. You see no cyanosis. The skin is warm. You're gonna feel the capillary a few times. We did this already, less than 3 seconds. And you're gonna move on to the pulses. Carotid was done, then you do the brachial pulse. Strong, rapid, and regular. Then the femoral pulse would be internally. Then you go posterior popliteal. Then you go posterior tibial, and the pedal pulse. The pedal pulse, you hold your thumb underneath the feet, like this. I just want to demonstrate. It is diminished and weak. It's the most distal. But the hair indicate the patient has circulation. The nail is a little bit thick, and I see the hair distribution is even. You also feel for warm. The lower leg is warmer than the feet is already colder, and you have the equal head distribution. Over here, you have some pigmentation changes, and the feet is a little colder, so it should be further investigate. And with that, can you please help? The respiratory rate 16. You see a normal breathing, no forceful, no tugging, no retraction. And you're gonna, palpate between the intercostal spaces for any tenderness. Do you feel any tenderness?
No.
The chest wall is symmetrical. No retractions. Now, what I'm gonna do, I'm gonna palpate the thoracic. Can you sit down? What you do is with this, the chest wall is symmetric. You inspect lateral, the back, the front, no barrel chest, no chest deformities, no scars, like I mentioned before, it could indicate some previous surgery or any trauma that could happen before, and it's symmetrical. So what I'm gonna do here is this is so I'm gonna palpate for thoracic expansion. Well, can you turn the like left leg? So about the 10th rep, you ask the patient to breathe, and your thumb should move away to palpate for, when you're palpating here, you're feeling for expansion of the chest wall. One more time. And my both fingers, they move away. So you see here that's it is symmetrical. The expansion of the expansion of the lungs here is symmetrical, right? If you see something from fingers will not moving, you have to also investigate. It could be also something underlying pathological condition that could be developing with the respiratory problem. Now, sit down. We palpate for diaphragmatis. The diaphragmatis, you use the base of your hand, okay, the base of the finger right here, and you ask the patient to say 99.
99. 99.
A little bit louder.
99. 99. 99.
So I feel a vibration. You should feel vibration. So now I'm gonna move on to the percussion of the chest wall. Do the same thing in the back. Then I'm gonna oscillate for breath sounds. Oscillate the breath sounds. You're gonna assess for rhonchi, for any rhonchi, for wheezing, for rails, and that could also indicate something: pneumonia, asthma, lung obstruction, or bronchial obstruction. Right? So you're gonna listen. Great. So you do this in the front and the back, and it's clear lung sounds, bilaterally, upper lobe and lower lobe. I just want to go over the upper extremities. There is even hair distribution, in case I miss. Even hair distribution. Can you hold my hands? Warm hands, no clubbing of the fingers, which you can see in patients that have emphysema. Can you put your fingers like this? So assess for clubbing. You see the nice diamond shape right there? That's a good sign. Thank you. So that's no clubbing. When there's clubbing, the diamond kind of, you don't see this diamond shape, which is very interesting actually. So this is the assessment of the cardiovascular and cardiovascular and respiratory assessment. One more time. Aortic, tricuspid, mitral, and the point of magnetic index. The rate is regularly strong and present. Thank you.